Hi, I'm Dr. Donald DeFabio, and welcome to The Natural Way to Better Health and Wellness. I've been in private practice now for 25 years, and as a lot of you know, I'm a chiropractic doctor, sports doctor primarily, and it's come to my attention that a lot of people really don't know what happens in my office on a day-to-day basis. I tell people that we examine and we treat and we give adjustments and we give exercises, and people who've been to chiropractic offices generally have an idea what that means. Other people, I kind of get that in the headlights look. And they go, oh, okay. Or I say I do examinations and I get the, oh. Well, guess what? Today we're going to do an in-depth look at what happens in the chiropractic office. So it's all about spine and sport rehab here at DeFabio Chiropractic. Let's find out what you can expect when you come into the office. Welcome back to the show, and it's all about spine and sport rehab here at DeFabio Chiropractic. When you come into your doctor's office, what can you expect besides a really welcoming environment? You have no reason to expect a nurse ratchet today. Those days are gone. So number one, the office should be inviting. But beyond that, you need to be able to sit down with your doctor and do a consultation. A consultation is when you sit down and go over the history of the present problem as well as a history of any prior problems. You consult, you talk, you review the health history. Generally doesn't take very long to do that, anywhere to 5 to 15 minutes at the outside, but a few minutes to sit down and talk to the doctor, going over history, everything that's accurate currently, as well as past surgical and medication and vitamins and minerals, what makes your condition better, what makes your condition worse, how did it start, provocative factors. A great thing you can do is write these things down for your doctor and bring them in, or be prepared. Simple questions are, when did it start? How did it start? What makes it better? What makes it worse? Can you make it go away? What do you have to do to avoid it? How it's impacted your life. And then simple surgical history, medication history, allergies. All of those things fit into it. Lifestyle questions. Are you a smoker? Alcohol, caffeine. How much water do you drink? How often do you go to the bathroom? Do you move your bowels? A really important question your doctor needs to ask, and they'll find out. So simple questions, consultation. At that point, we will then ask, all right, it looks like you're going to be a candidate for the services we provide here. The doctor will have a working diagnosis at that point. There is no substitute for a good consultation. I learned that in chiropractic school, and I still stand by it. I have a very good working diagnosis after I've spoken with somebody on what I need to examine, which is part 2 of the initial visit, the examination. What does the examination include? Well, the examination includes physical exam procedures. What is that? Well, simple things. Vital signs, blood pressure, height, and weight. In my office, we take the blood pressure on the left and right sides. Why? Because sometimes there's a difference that's greater than 10 millimeters. And if that's greater than that, it tells me certain chiropractic procedures need to be avoided for you. So it's a screening procedure that we use to be a little more thorough. So vital signs, pressure, blood pressure, height, weight, that's the starting point. Then range of motion, flexibility of the area that's involved. In our office, we do the spine, we do the neck, we do the back, arms, and legs. We also go over reflexes with the little hammer. That checks the nerves. We check muscle strength to see if the muscles are strong, checks the nerves. We check for other nerve tests, meningitis, spinal cord tumors. Nerve tests. We can check nerve tests around the eyes, ears, nose, and mouth, your cranial nerves, to see if there's something wrong with the connection from the brain directly to those areas. So that's a neurological examination. Just takes a few minutes. An orthopedic examination is next. That is checking the joints for ranges of motion, checking the muscles for their integrity. Do they contract and expand and lengthen the way they're supposed to? Checking ligaments and tendons. If it's the knee, we check the cartilage. So that's the orthopedic, the joint movement part of it. The third part is the chiropractic examination, posture evaluation, and also functional assessment, because chiropractic is about posture, alignment, but it's also about function. Does the spine move properly? Do the joints move properly? Every joint in your body is supposed to move through a full range of motion. If it doesn't move through its full range of motion, then it's going to be compromised. Chiropractic restores that range of motion, so we want to know that. So a functional chiropractic assessment is part of that as well. We may need to look into vascular tests. We may need to listen to your heart or your lungs. Not real common in a chiropractic office, but it can occur because we are physicians. So it's an orthopedic examination, it's a neurological examination, it's a chiropractic examination, and then at that point, it's my job to think about what else do you need? Do you need advanced diagnostic testing? It could be something simple as x-rays. It could be something as far as an electromagnetic or nuclear bone scan, but it might be an MRI, it might be a CAT scan, it might be go see another doctor, a cardiologist for a stress test, or maybe you need an EKG to rule out if that chest pain is coming from your back or if it's coming from your heart, or even your neck. We've seen plenty of people coming in with chest pain and it's actually referred from their neck. So initial examination, then the doctor will discuss with you what diagnostic tests you need to be ordered. And again, it could be something simple, x-rays or blood tests, or something more extensive, CAT scans, MRIs, or other scans. That is the initial visit. Consultation, examination, and then integrate all that information to determine what diagnostic tests that you'll need. The doctor, or me in this case, then takes all that information, correlates it, and tells you what's wrong. That usually occurs on the second visit. We call that a report of findings or a review of the symptoms and all the test results. So to give you an idea of what a report of findings is like, I'm going to let you watch a real report of findings in real time and how I talk to my patients and what you can expect to hear from your doctor about your healthcare concerns. So I'm Dr. Donald DeFabio. We're going to take a short break right now, and when we come back, it's all going to be about a chiropractic report of findings. Hi. Bone and joint health is the topic for today's tip. Do you know you can improve your bone and joint health with bone morphogenetic proteins? These are naturally occurring proteins that are found in the body and can be taken as a supplement. These proteins stimulate the body's stem cells to produce bone and cartilage cells. So in other words, if you can increase the production of bone and cartilage cells, when you take calcium supplements, the bone will have something to bind to. And if you take glucosamine and chondroitin, that'll have something to bind to because you have more cartilage cells. You can take bone morphogenetic proteins as a simple, over-the-counter supplement that's safe. It's called Ostenol, and it can be found online. Zycal Bioceuticals makes them. It's the only manufacturer of Ostenol. It also comes compounded already with glucosamine and chondroitin if you want to take them together. So improve your bone health with bone morphogenetic proteins, great for arthritis, great for osteoporosis and osteopenia, Zycal products, Ostenol, and Congenol. Welcome back to the show. I'm Dr. Donald DeFabio, and the first segment was about the examination, consultation, history, diagnostic tests, data gathering. I've done all that. Now I want you to experience what we call a report of findings or a review of a patient's conditions. You are going to see an accurate, real-time report of findings right now with Jill, and you can experience it exactly the way she does. Let's get started. Hi, Jill. Thanks for coming today.
Thank you.
Now, I want to tell you what your diagnosis is. Your clinical diagnosis is lumbar pathomechanics with neuralgia, myofibrosis, and segmental dysfunction. I know that sounds like a lot, okay? But in real words, in simple terms, what it means is pathomechanics, abnormal joint mechanics, with neuralgia, irritation of the nerves, myofibrosis, tightening and stiffening of the ligaments and the muscles, as well as segmental dysfunction. That's another type of pathomechanics. We talk about that when it's in the extremities, in the knees, in the hips, in the feet, okay? But basically, it's a loss of normal joint motion. What does that mean? Well, let's look at the spine. Right here are two vertebrae. These are the vertebrae. These are the discs. These are the nerves. These are the bumps in the back of your spine, so you're standing just like this. These are the joints of the spine. That's where all your motion occurs. That's where all your movement occurs. Normally, the vertebrae move equally. In your case, they've jammed up and they've gotten stiff. They've gone from normal mechanics to abnormal mechanics. They're locked up and stiff. That then creates irritation to the local tissues. The muscles will shorten and tighten if it's been there for a while. That's that myofibrosis from your old auto accident. That's why you have that stiffness in your neck that never seems to go away, because it got injured and the muscles and the ligaments over time shorten in that position. Conversely, when you get the pathomechanics, nerves don't like to stretch. Muscles like to stretch. Nerves don't. So when this happens, the nerve on this side gets compressed and irritated. The nerve on this side gets lengthened and stretched, and it doesn't like it. So that's the neuralgia, the irritation of the nerves. All right? So it's pathomechanics, creating neuralgia and myofibrosis. A lot of big words, however, it's very straightforward. The good news is it's all treatable. Pathomechanics can be treated with chiropractic adjustments. That is a type of chiropractic therapy where we loosen it up. It's gentle, it's pain-free. I'll explain that more to you in a moment. But that's what creates the movement. If we don't take those areas of pathomechanics, we have abnormal joint motion, and restore normal joint motion, they're never going to get better. So you need to correct the mechanical problem. I'm going to just put that down. On top of that, then we need to work on those muscles that are stiff and tight, that have been shortened. That's where we'll do some soft tissue work. We'll use some heat, we'll use some electrical stimulation, some muscle stimulation, a type of physical therapy to relax the muscles, so then we can then lengthen them. And again, I'll use my hands doing a procedure called active release. I'll also use some tools, some simple tools, Graston it's called. What you have to understand now is we're going to treat the muscular component too. Research has shown you treat the joint component and the muscular component at the same time, you not only get better, you get better faster. And that's the name of the game. So short-term goal, get you feeling better. Second-term goal is to correct your mechanics. And then ultimately we want to give you strengthening and corrective exercises to stabilize it so it stays that way. So the first thing we need to do is correct the mechanics, get you feeling better. The second phase of the care is corrective care, where we strengthen and stabilize it. All right? Now I have all that written down in a nice little chart here, which I'm going to show you in a moment, but let me show you your x-rays. These are your x-rays. Here we're looking at your back from the back. So this is the left side. The left leg as it comes into the socket is here, and here's the right leg as it comes into the socket. The top of the left hip, top of the right hip, and the vertebrae. Overall alignment in the lower back is pretty good, not too bad. You're listing off a little bit to the right because your right leg is 13 millimeters shorter than your left. That's about a ½ inch, okay? That's quite a bit. When we get up to your hips, it's 14 millimeters. So again, you're listing off to the right. That's why you're getting the pain in the hip radiating down into the knee. So I know you want to get back to the gym. I know you're into working out again to just get back into shape, which is great, a commitment to a healthy lifestyle. But the reason your knee's bugging you is because of the shortness in the leg is creating a lot more pressure. We're going to need to put a footbed, an orthotic, inside your shoes to balance that up. They're comfortable. You won't even know it's there. You can wear them in your everyday activities. I have an example of one right here. It's a very low profile. It'll fit into your everyday footwear. Yours will build up this heel a little bit to balance you off, and that'll prevent your knee from keep bothering you and your hip from keep bothering you as you continue to exercise. So that's how we're going to correct that. From the side view, these are the vertebrae here. Here's your tailbone. Here are the disc spaces in through here. These are the holes where the nerves come out of the spine. So if we were to hold the spine up right next to it, it would be we're looking like this. So here are the nerves, very large hole here, very large hole here. You see how this one's really small? This disc is a little bit thinner. You're getting this. There's your pathomechanics. That needs to be restored with adjustments to get that to restore. All right? That's my job. All right? Once we get that loosened up, then we can give you some corrective exercises. So let's wrap all this up because it's a lot of information. Your primary problem is right here in your lower back, all right? Chiropractic is very simple. It's all about opening up the nerve flow from your brain, through your spine, out to your organs and muscles. If the nerves are working better, the organs and muscles are working better. If the organs and muscles are working better, you're healthier. So very simple, but very powerful. We're primarily concerned with your lower back, but we're also going to make sure your whole spine, as well as your knees, hips, and pelvis are balanced. What's wrong? Well, you knew it was stiff and tight. That's why you came in. Now we can see the position, the alignment issue. There is, in your case, an irritation on the nerves. We know you don't have a pinched nerve or a slip disc from your examination findings. You do have some muscle spasms, which we saw your x-ray as your spine's listing off to the side, as well as the fact that I felt it in the examination. The good news is no real degenerative changes, so that's good. If you do have arthritis, we can still treat you. I just have to use a different type of treatment, all right? So how long is it going to take to get better? Well, that depends on how aggressively you want to treat this. You should feel significantly better in about 12 sessions, all right? Within 12 sessions, you should have about a 50% decrease in pain. Our primary concern is with initial intensive care is to reduce your inflammation, increase your range of motion or your flexibility, and to get you feeling better. As soon as you start feeling better and the pain goes away, we talk about that corrective care, the strengthening phase of care to stabilize the area. Once you get muscle ligament strengthening and spinal stabilization, then you'll hold the correction. So the first job is to restore normal mechanics. Second job is to stabilize it with exercises. And then ultimately, if you want to come in for wellness, elective care, that would be great. But that's a lifestyle choice. That's a totally different animal. First, let's get you feeling better. Then let's strengthen and stabilize it. Then, if you want, you can come in once a month, once every 2 weeks for preventative and wellness care. Completely different animal. So that's my commitment to you, is to exceed your expectations. However, you do have a few responsibilities. Number one, get involved. You need to be involved with your health care. Communicate with me. Let me know what's going on. Number two, you need to be here for your adjustments. I just got an adjustment yesterday. I get an adjustment every 2 weeks. That's what I need. However, you need to be here for your adjustments. I can't adjust myself just like you can't. However, we have optimum patient availability times for appointments at any time for your convenience. During the corrective phase of care, we'll talk about lifting, bending, reaching, ergonomics. That's when we'll correct all those things. Make sure you get enough rest. If you don't get enough rest, your body won't heal, so you got to get sleep. You need to eat healthy foods. If you're not eating healthy foods, your body can't recover. White sugar, grains are pro-inflammatory. I have a handout out front about anti-inflammatory diet. I highly recommend you pull it out and read it. Lastly, ask questions. I always have time to answer your questions. So my commitment is to be accessible to you, but also to give you the time and care you need. So everything in here is written down about chiropractic and your health care. Take that home, read through it, and let me know if you have any questions. I know it's a lot of information, but right now, are there any questions for me?
I'm looking forward to feeling better. Thank you.
Well, sounds good. Now let's, I'm going to have my staff talk to you about finances. We do financial consult before any treatment, so there's no surprises in that regard. And then we'll get started.
Thank you.
All right, thank you. That's it. That's a real-life report of findings or second visit. And you can be expected to receive the care you need from your doctor, just like I did. So we're going to take a short break right now. I'm going to give you a little health tip, and then we come back, we'll talk about chiropractic treatment and what an armamentarium, a bag of tricks is for treating your condition chiropractically in spine and sport rehab. Hi, I'm Dr. Donald DeFabio with your anti-obesity tips for you and your family. The first thing you have to understand is you need to eat more fresh fruits and vegetables. They're high in nutrients and they're low in calories, so that's the most important. Eat more fresh fruits and vegetables. Next is you need to stop all soft drinks. Soft drinks will increase your risk for high blood pressure and diabetes, even the zero-calorie soft drinks. So just stop all soft drinks. Next, if you want to drink something, you have to drink something. Drink green tea, drink water. Green tea and water are the best drinks for you. If you want to spice up your water or make it a little more interesting is a better word, add some lemon juice or some lime juice. In terms of protein, protein's okay. portion size about the size of your fist, and make it a lean meat, fresh fish or wild-caught fish, and lean protein. In terms of the junk food, just stop the junk food as well. Cakes, candy, sweets, the foods that are high in calories, high in fat, high in sugar, and low in nutrition also need to be avoided. If food is an emotional trigger for you, well, then you need behavior modification. See a counselor. In terms of how frequently to eat more often. 5 to 7 meals a day will stimulate metabolism, and you'll actually burn up more calories eating more frequently. So those are the simple tips that you can apply immediately about staying lean and preventing obesity. And remember, if you sleep, you not only stay healthy, but you also burn more calories, ironically. So sleeping is one of those tips as well. I'm Dr. Donald DeFabio, and take care of your health. You deserve it. Welcome back to the show. What we really do here, my number one job is diagnosis. I need to determine what your problem is and if it's something that I can treat with one of the many tools in my armamentarium. And that's the next phase of today's show. Let's talk about all the tools that I have accessible to me to treat your condition. So we had the examination, we had the report of findings. I evaluated all that information and I determined, was the problem a muscle issue? Is it an injury to the joints or the ligaments or the tendons or the discs or the nerves? Once we knew that, then I set up a treatment plan. We discussed that in the report of findings, and now it's time for treatment. And patients often say, well, what's that? Well, it starts with chiropractic treatment, or adjustments is the big name, but you can just understand it as a chiropractic procedure or therapy. What it means is I take my hands generally, sometimes I use an instrument, and we find those areas of pathomechanics, abnormal joint movement, and we get them to move better. If I'm using my hands and touching or using the instruments on an area that's sore, it's going to hurt. If I'm not touching and poking and prying on an area that's not tender, all you feel is finger pressure. So the adjustment is to find those areas of pathomechanics and to create normal mechanics to restore joint movement. That's how that works. It is pretty straightforward. And if it's in the spine, we work on the spine. If it's in the extremities, let's say an elbow, for example, well, the elbow needs to move properly. We get on there with my hands or with the tools, and then we get the elbow to move properly with a chiropractic therapy, or we call it an adjustment. To understand how it feels, well, you have to receive an adjustment to understand how it feels. But you can see visually and now intellectually understand it's taking pathomechanics and restoring normal joint mechanics. It is a painless procedure by itself. It only hurts if we're working on an area that's sore. And it's my job to work around the inflammation and soreness to make it as comfortable as possible. However, there's lots of different ways that we can adjust a neck, a knee, a shoulder, or an elbow. There's lots of techniques that I have available. Everyone thinks chiropractic is low amplitude, high velocity, popping and cracking. That's a traditional chiropractic procedure, and I use it frequently today. But guess what? That's not the only way to adjust the spine. In fact, what I like to say, there's more than one way to skin a vertebrae. There's lots of techniques I use. Some are the antithesis to that. They're low velocity and low force. Slow and easy. No popping, no cracking. And I may use a low velocity technique on one area of the body. Let's say in the neck, it's very common to use low velocity techniques today. It's called stair step or SOT. Yet in the lower back, we may use flexion distraction, which is great for slip discs, where we open up the joint spaces. Low velocity techniques. Mid-back or in the elbow, I'll use a high velocity technique frequently because it works really well, where it's a very short amplitude, a quick impulse, it's over and done with, and those are the times we get the pops and cracks. Ironically, some people love the pops and cracks, and some people don't. That's not the goal of the treatment. The goal of the treatment is to get the range of motion back, not to make the noise, to restore normal mechanics. But we talked about that in the ROF section. Let's go back to treatment. So you got to take a chiropractic adjustment to restore mechanics. But what about all the other tissues? What about the ligaments? What about the tendons? What about all the inflammation in the discs, let's say? Well, that's where we use our modalities. Modalities mean electrical muscle stimulation, ultrasound, heat, cold. things that are going to decrease pain, decrease inflammation, maybe improve circulation, but treat the soft tissue. By treating the soft tissue, it helps get the adjustments and the mechanical treatment to work better. The other way we really like to address the soft tissue component, now again, you have your joints and you have your soft tissues. The soft tissues are your ligaments, your tendons, your muscles. Those can be addressed by manual means. I can get in there and find the knots and work them out with my hands, a procedure called active release technique. I've been doing it since 1991. It's very popular in the triathlon circles. I mean, that's where I learned it when I was a doctor at the Ironman triathlons from 91 to 99. So I studied ART exclusively for many years. It works great. And that's with my hands to break down knots and scar tissue. And I'm in there pretty good, but after we get done, boy, it feels so much looser. Another technique we use for the knots and the scar tissue and to lengthen those tissues is Grafton, where we use a tool, a stainless steel tool, to get the muscles and the ligaments and the tendons to work better. A lot of times we have runners come in even before the day of their race and we do Grafton on their legs to keep them fresh and to keep the muscles elastic. What you have to understand about muscles is they want to work like a rubber band, not like a rope. And when they get injured from overuse or injury or just time, neglect, they start to get tight and stiff like a rope. We need to get that elasticity back for them to function properly. Adjustments, working the joints alone, whether it's the spine or whether it's the knee if we're working on the legs, aren't going to correct the muscles. You need to get in there and work the muscles too. And research has shown if you do the muscles and the joints at the same time, if you treat them both, people not only get better, they get better faster. So that's why in my office, I'm all over doing the soft tissue myofascial work along with the traditional chiropractic adjustments. And again, those adjustments can be high velocity or low velocity or a combination. Beyond that, we use kinesiotape in my office all the time. Kinesiotape is that black tape that was on Kerry Walsh's shoulder at the 2010 Olympics in women's beach volleyball, if you saw that. It's a sports taping. However, it gives flexibility, it's not rigidity, keeps inflammation down, and it stimulates the muscles in the area to work better. I've been doing kinesiotaping for several years and I've taken the certification course in it. It works great. And when it works, you'll feel the difference as soon as we put it on. And you can leave it on for a few days and you can do your athletic activity with it. But our non-athletes use it all the time as well. Beyond kinesiotaping, we also have therapeutic corrective exercises. I've always been big on exercise. I'm a runner myself. I'm also a personal trainer. So when people come in, a common question I hear is, Doc, what can I do on my own? Is there anything I can do to work this out on my own? Well, that's what all this is for. That's what all the bands are for. That's what all the balls are for. That's what the corrective exercises are for. That's where we do our functional movement assessments, where we teach people how to move better and move more efficiently to be more active in their everyday life. So my bag of armamentarium, my tools of my trade, there's a lot of them. I am definitely not a one-trick pony when it comes to chiropractic treatment modalities. We have soft tissue modalities with tools, without tools. We have adjusting modalities and treatments that are all different types. A high velocity, low velocity, kinesiology, popping, cracking, non-popping and cracking, and exercises and rehabilitation, whatever you need to get back to doing what you want to do. That's my job to provide it for you. That's a little bit more about chiropractic as you can expect it here at DeFabio Chiropractic, but guess what? If I can do it, your doctor can do it as well. So feel free to call me with any questions, but talk to your doc about what they expect you to provide for them to provide for you, because it's a two-way street. I'm Dr. Donald DeFabio, and I want to thank you for tuning in today. And remember, your health is your greatest wealth, so take care of it, and you're young as your spine is flexible. Have a nice day.